People living with a severe mental illness such as psychosis in the UK have a life expectancy that is 15 to 20 years shorter than average. People with schizophrenia are up to 3 times more likely than average to have diabetes. Young adults with severe mental illness, aged 18 to 49, are 3 times as likely to die from heart disease, and those aged 50 to 75 are twice as likely as average.
We believe that we all, regardless of where we live, have an equal right to good health and effective healthcare. No one should have poorer physical health or healthcare just because they have a mental health condition. Our shared vision is that everyone living with a long-term mental health condition has access to effective, timely, consistent and responsive help at every stage of their life for their physical health and has an equal chance of enjoying a healthy and ultimately equal life expectancy.
People with long-term mental health conditions die around 17 years before their time. These are the stolen years of life, and for too many this means living for many years in pain with reduced quality of life. We want to win back these stolen years and make sure people with mental health conditions have longer and healthier lives. We know this will not change quickly, but we must take action now and sustain it over time to close the gap long term.
We will strive together to ensure that people with mental health conditions can get access to high-quality help to improve their physical well-being and to prevent, treat and manage physical health problems. We will seek to ensure that people are offered support that is tailored to their needs, that is consistent and seamless, and that is empowering. We believe that people living with a mental health condition should be offered effective, empowering support. Mental health service providers should work with primary care to ensure annual physical health checks. Primary care and public health services should have the right support to reach out to people with long-term mental health conditions. All health and care workers should be trained, supported and equipped to support the physical health of people with mental health conditions. Providers and commissioners of health services should collect and publish routine data.
Equally Well is a collaboration of organisations brought together by Centre for Mental Health, working in partnership with Rethink Mental Illness, an expert by experience group and a clinical group, and members across the UK with a shared aim to improve the physical health and therefore quality of life and life expectancy of people with long-term mental health conditions.
Equally Well is a partnership bringing together Centre for Mental Health, Rethink Mental Illness and experts by both experience and profession working for a common purpose and shared passion for equal health alongside the members.
Equally Well UK Expert by Experience Group is at the heart of everything we do, from defining our priorities to co-producing our resources. Equally Well Experts by Experience have spoken at major national events and meetings to bring the voice of lived experience to the fore.
The Equally Well UK Clinical Group are leading experts from national bodies from across the spectrum of specialities and disciplines who work with us on key aspects of our work. The Equally Well Clinical Group combines knowledge, intelligence and passion from experts across disciplines including medicine, nursing, occupational therapy and pharmacy.
We believe that no one organisation can close the early mortality gap alone, so in building a network of organisations we are enabling people to share ideas, best practice, intelligence and knowledge through our resources, events, website and on social media. Joining Equally Well enables organisations to become part of this social movement and to show their commitment to equal health.
In autumn 2019, we surveyed member organisations of Equally Well UK to understand more about their experiences of belonging to the collaborative so far, their current work in relation to its objectives, and their views about how Equally Well can best support their work going forward.
Since launching Equally Well UK, we've become a major resource for information and ideas, building up the nation's knowledge and an interest in equal health. We have 12 podcasts alongside our members, the Mental Health and Royal College of GPs, produced 6 videos, published 34 blogs, over 2,700 Twitter followers, published 3 Equally Well briefings and shared 48 from our members.
We've reached more than 300 people with our member networking events and webinars. Our events are co-designed with Expert by Experience and give opportunities for members to network with and learn from one another. We've held a joint event with Closing the Gap and COVID-19 focused webinars with Public Health England and another with NHS England and Improvement.
We have brought physical health to the heart of national mental health policy, supported major reports from members including Action on Smoking and Health, Royal College of Nursing, Health Education England and Public Health England, put a spotlight on mental health in the National Diabetes Audit, informed responses to COVID-19 and supported people living with mental illness during the pandemic.
Equally Well UK is one of 3 national collaboratives linked to our equivalents in New Zealand and Australia. We participated in an international meeting of Equally Well collaboratives and similar initiatives in Washington, D.C., and have spoken at national events in France and Australia to help build a global movement for equal health.
There is a lot more to do to make equal health a reality. Our priorities for the next year include healthy weight management, smoking cessation, physical health checks, race inequality, prevention and early intervention. And we will continue our programme of events for members and supporting organisations to put their pledges into practice nationwide.